Good afternoon, everyone, and welcome to our Ask Me Anything session for oral surgeons. I am Veronica Figueroa, Director of Specialty Support at Aspen Dental Management, and we are excited to spend the next hour or so answering as many of your questions as possible. Before we get started, let us review how the questions will be taken. At the bottom of your screen, you will find the Q&A function. Please type your questions and we will make sure to cover as many as we can during our time together. Let's have fun with this and get as much information from our panelists as you need. You should know that between all three of our talented panelists, Dr. Nazee, Dr. Chisholm, and Dr. Whiting, we have over 20 years of Aspen experience. It does not get any better than that. Our goal today is to help you understand more about our specialty model and how you can play an integral part of our Aspen family. Now, before we begin with taking your questions, I want to give the opportunity to each of our panelists to introduce themselves. Tell us where do they live, where did they attend dental school and residency, and how long they have been with Aspen. So why don't we start with Dr. Chisholm, then followed by Dr. Nazee, and then Dr. Whiting.
Hello, my name is Dr. Mark Chisholm. I currently live in Atlanta, Georgia, is where I practice with Aspen Dental. I attended dental school at the Medical University of South Carolina, and I also did my oral surgery residency at the Medical University of South Carolina, and I've been with Aspen for 6 years.
Hi, everybody. My name is Nazee Abu Nasra. I went to school in Vancouver, Canada, and then moved to New York City, where I did my oral surgery at Montefiore Medical Center. I joined Aspen immediately after graduating from oral surgery since 2005, and it's been my 15th year with Aspen Dental.
My name is Justin Whiting. I am in Pennsylvania right now. I went to dental school, University of Maryland, and I did residency in Brooklyn at Kings County Hospital. I've been an oral surgeon with Aspen for 2 years. I worked as a general dentist for Aspen before residency in Massachusetts as well.
Thank you guys for taking the time to join us. And it looks like we have our first question, and so we'll get started. And I'll direct this question to Dr. Chisholm. What are the pros and cons of working at Aspen Dental?
That's a good question. Let me qualify your question by giving you a little bit of my background. I've practiced in most phases of oral surgery now. It's in the military and the Army for 3 years after my residency. And then I was in private practice for 13 years after I left the Army, and then I joined Aspen. So I think I have enough experience at this point to kind of be able to answer that question. As far as the pros and cons, this could be a topic all in and of itself. Pros is that you don't have the normal headaches that you have of running a private practice. Private practice has its own unique challenges in that you've got to worry about paying taxes, paying employees, keeping the doors open. Is electricity working today? Dealing with the accountants, dealing with your account receivables, your account payables. It's a whole different ballgame. And while it's not bad, there's a lot of headaches there that you don't have to worry about with Aspen. With Aspen, I go, I operate, I do my day's work, I leave, and I don't have to worry about, the office or how it's being run or how my employees are going to get paid or how do I deal with their payroll, their benefits and retirement. There's a lot of positives from that standpoint. As far as the cons go, with private practice, you have more autonomy about where you are, where you go, your hours, how you want to do this, how you want to do that, for sure. However, Aspen does allow you a lot of flexibility with your scheduling and how you want to deal with patients and how you want to operate. So in my opinion, for the amount of time that I have in private practice and with Aspen, the pros far outweigh the cons for me to this point.
Thank you, Dr. Chisholm. So Dr. Nazi, you mentioned you joined Aspen straight out of residency. So this question I think would be appropriate for you. Did you feel like you were prepared to take on difficult cases on your own without a mental oversight?
So yes, this is a good question. I wouldn't say I struggled, but I asked a lot of questions that maybe I did not have somebody to mentor me. But this is the good thing about education before and even now. When I started at Aspen, I was like joining a lot of study clubs. I was flying to a lot of meetings. One is, yes, to study for my board, and two is to educate myself even more. And I believe, I did very well from the point where, I rarely struggled with something that I said to myself, I wish I had somebody on the top of my head mentoring me. Obviously, at Aspen, when I started, there were other senior oral surgeons that I could have called and get the help of them. But I honestly, I don't want to say I self-educated myself, because I received a very good training during my oral surgery residency. So maybe I needed certain answer to few questions, but this wasn't at all an issue to me. And I want to add that yes, I did join Aspen State out of the residency, but we have a lot of oral surgeons who did the same thing, and they're all maybe agreeing with me that initially you really don't need a full-time mentor to coach you doing oral surgery procedure.
Veronica, can I piggyback on what Dr. Nazi said? I wanted to add here that it was very helpful to have people like Nazi and some other oral surgeons who have been with the company longer. When I first joined, although I had a lot of oral surgery experience, I didn't have Aspen experience. So I can tell you what is valuable is to be able to call the folks like, well, me now, or Dr. Nazi, who have been doing this for a long time with Aspen, to help to give us the best practices. How should I do this? How should I set up my schedule? How do I, deal with this problem or that problem where Aspen is concerned? And so those guys were really very helpful with that part of it, because it is a different way to practice than I was used to.
That's a good insight. This question just came in. As an oral surgeon, how do you see your role in the implant model that Dr. Judge and Bob Fontina just talked about earlier? And I'll Dr. Nazi, if you want to kind of join here.
So, I did not attend the presentation earlier, but I'm very familiar with the Aspen kind of like model in general. When I started at Aspen, one of the issues or one of the main problems that I realized that the majority, if not all, but I want to say the majority of the general dentists had very little experience with dental implantology. So in reality, I was the one who was dictating the treatment plan and the final outcome. And this is not the right way to do dental implants. The correct dental implant model should be dictated starting by the restorative dentist, and then grouped with the team, including the surgeon, whether it's a general dentist or an oral surgeon or a periodontist, and the lab tech. And this at Aspen was available, but there was not a concrete model that we started initially. So, but now the fact that most, if not all, the dentists who are employed at Aspen are joining those models, the education, the webinar. In my opinion, this is the best, because now it puts all of us all of us in the same room at the same level. Yes, I do have the experience about placing implants, doing bone grafting, and all sorts of things. But when I started, I would say I had very little restorative experience related to dental implants. I even started going to restorative meetings. I mean, meetings designed for general dentists and prosthodontists regarding dental implants, because you really need to understand the restorative aspect of dental implants if you want the whole model to succeed. And right now, the model is excellent. I mean, I know Aspen Dental contracted, hired a prosthodontist who's leading the team, which to me is one of the most important aspects of dental implant is the restorative outcome, treatment planning, and everything. So I am very happy with the implant model that Aspen started and continuing. The other thing that maybe Dr. Chisholm can add, the modalities that we have available. We have lab techs who are being trained by top, lab techs from other implant companies. We have software. We have, 3D cone beam modalities in our offices. So kind of like we have a scanning, intraoral scanning. So this is all designed to make, the implant model more successful. Plus, you have the person who the model is aiming at planning or already planned the procedure, already worked up the procedure, is in discussion with you before or at the same time of the procedure, available in the office to even for you, if you have any questions or feedback, you can get. So, I mean, to me, it's a perfect model that we have right now.
I'll add on there. Dr. Nazeeh hit the nail right on the head. Because Aspen is such a large company, and I'm sure we'll get into this later, there's something called economy of scale. And let me explain this to you. When you're in private practice, because you're not a huge group and command a lot of the marketplace, you don't always get the best rates in insurance. You don't always get the best prices with supplies and that kind of thing. So one of the huge pros that Aspen has is because it's such a large company, it demands better rates with insurance companies, with suppliers. And the reason I say that where implants are concerned is, one, we are able to increase our profit margins because our supplies come cheaper, which helps out a lot with implants. Secondly, Dr. Nazeeh mentioned cone beam CTs, 3D CTs. Now, all of the offices are pretty much incorporating that. And so we have cone beam opportunities in almost every office that we go to now. A lot of private practices can't, or general dentists can't afford to do that, or may not have the space in their offices. So all this stuff really helps out with a team approach to implant treatment and planning. And also Aspen offers a myriad of continuing education opportunities for the dentists and the oral surgeons and encourages us to work together as a team. So when you have the general dentist, the laboratory tech, and the oral surgeon all in the office at the same time, it's a great advantage when you're treating patients or when you have questions amongst each other, which is another pro that you don't have in private practice.
Thank you, Dr. Chisholm. Dr. Whiting, how did your program director, chiefs, or other colleagues perceive your decision to pursue a career in corporate setting compared to a more traditional private practice or hospital-based work?
Yeah, my program director, I think the old-fashioned oral surgeons definitely look down on it. It's not how they perceive how they want oral surgery going forward. So you kind of have to humble yourself and be like, there are going to be some people that don't understand your decision, but that doesn't mean it's the wrong way. I mean, it's different out there than when, my program director retired the last year I was there. I think he was like 68. It's much different than when he started practicing oral surgery from how it is now. So, there's always going to be people that think maybe you're making the wrong decision, but the more and more it's becoming more like this, where corporate dentistry is a much bigger player in the oral surgery world. So you're just gonna have to deal with that. Just not everyone's gonna agree with your decision.
Makes sense. And everybody's got to find what's right for them, right?
Yeah.
Like anything else in life.
Hey, Veronica,
Yeah, Dr. Chisholm.
I'm sorry to be a big mouth here, but I wanted to say I'm part of that old school generation that looked down on corporate dentistry, on DSOs. I was the state board examiner for South Carolina for a few years, and I really fought against the DSOs coming into the state of South Carolina. And I will tell you that that is an old philosophy, that those who can't go into teaching or sign on with DSOs, that is not the case anymore. If you had told me 15 years ago that I was going to be working for a company like Aspen, I would have told you you were crazy. But now, there's even more and more guys in DSOs who are on state boards. So it is an accepted way of dentistry. It's been, organized medicine has been out there for years and years. My wife's a pediatrician. She worked for a huge company similar to Aspen, but on the medical side. So, I did have a little chip on my shoulder when I first started, just because of my old style of thinking. But it is now, I can't really say standard of care, but it's a standard of the industry. And, either you get on board or you get run over by it. You cannot get caught up in stigmas, whether it be military, private practice, or DSO. You've got to find what works for you. And I can tell you, you can be successful in any one of those arenas, and they all have their positives and negatives. There is no perfect way to practice oral surgery. I'll tell you again, there is no perfect way to practice oral surgery. I've done most of them now, and they all have their pitfalls and they all have their successes.
I like to add too, I think that's why we should become more active in the community that we're in, because we kind of are isolated a little bit. So, I've been lucky that the biggest private practice in my area, there's about 13 oral surgeons. I'm taking call with them, so they get to know me. So, it's easy to hate who you don't like, who you don't know. So once they know me, they know I'm a good person, I'm trying to do the best by the patients and everything, then their mindset kind of changes a little bit on some of that. So I'd say just get involved in the oral surgery community as much as possible, and that definitely helps.
So this next question, I think I'm going to direct it at Dr. Nazee. What is it that has kept you with Aspen for as long as you have, and why would you advise doctors to pursue the same route?
So the most important thing to me is I'm very happy. So I feel I am well treated at Aspen, not because I am a senior 15-year-old oral surgeon. I just, my daily practice, almost other than, difficulty with seeing some patients, but goes very smooth. I'm very happy with the outcome. I'm talking about my production, not necessarily from the quantity of procedure, but the quality of procedure. I enjoy going to a different office every day. I enjoy meeting, many people. I mean, I met a lot of people. Dentistry, hygienists, office management, or managers. So to me is, I don't want to compare it to residency or dental school, but the fact that, I'm able to meet a lot of people, the fact that I'm able to perform what I want to do, which is oral surgery, and more importantly, I am well compensated for my, work. So this is very important for the people who did not work in private practice or outside residency, is the compensation. You want to be compensated for your work. And when I started with Aspen, I never worked, so I wasn't sure what I was getting into it, but I was well compensated, and I continued throughout my 15 years. So I'm very, very happy with the, my daily production, my daily work, my, meeting different people. Traveling to a different office is not a big issue to me. I've been doing it for about, as I told you, more than 15 years. I like one thing also very important, the fact that I feel I am part of the Aspen bigger family. I'm not talking about the daily people that I meet. I'm talking about the corporation too. So Veronica is one example. I know a lot of people who I don't see every day. I don't see even every month. I might see once or twice a year, but we're always connected. So to me, this is another thing that I feel like I'm part of a bigger family. Dr. Mark and Justin also, we see what we meet once maybe a year. We might chat more than that, but also when we meet once a year or twice a year, it's like a very pleasant meeting that we all hang around, chat around. So this kind of like, this is another reason it gives me the motivation to continue. I want to tell you that I am also, I have full freedom as long as I respect my duty to my work. I can take my vacation anytime I want. I can dictate what time I start and I leave, but I do my job. So I am, whatever work needs to be done, I am committed to. So I am very happy. I feel myself, I am my own boss, which is, I am sure any oral surgeon or specialist can do the same. So that's why these are many, many reasons why I am like 15 years, I'm still with Aspen. And I strongly believe if I leave Aspen, it will be my retirement, decision. It's not like to join somebody else.
Thank you, Dr. Nazeed. So this next question has to do with something that Dr. Nazeed just mentioned, and so I'll kind of leave it up to whoever wants to answer it. But what does a typical day schedule look like for you, and how many patients are you seeing? How many hours are you working a day?
I guess we all may have different practices and the different ways we want to do our practice. And that's another thing, similar to what Nazir was saying, you have the flexibility and the most important word, the autonomy, to be able to set your schedule as you see fit. Here in Atlanta, the traffic is absolutely murderous. I mean, it is the worst. So I set my day around trying to get to work early enough, get my surgeries done, and be able to get out of there so I can get home before the traffic gets crazy. And so it's a to thine own self be true situation. I know my speed. I know what I can do. I know how to set my schedule after this many years of oral surgery. So my days may be different from Naziz's or from Justin's days, but the way that I do it, I typically do about 9-10 sedations a day and some follow-ups and some uncoverings and maybe a local or two sporadically in there. But I will either increase or decrease my days depending upon what I have going on outside of work or how far I am away from home. I'm also very, very conscious about my assistants' time and how far they have to drive on a daily basis and what their needs and wants are as well. So, I've been able to maintain basically the same assistant staff for the entire time I've been with Aspen. And it's actually better than the assistant time that I had in private practice. I had people coming and going every other year, but we've been able to make this pleasant enough for our assistants and doable enough so that it's a better lifestyle for them than they even practice. And I also want to say, just mention this real quickly. I did not join Aspen because my private practice did not go well. I had a phenomenal private practice. It's just, I was practicing in South Carolina. My wife hated where we were, and she wanted to practice someplace different. And so we left South Carolina to come to Georgia. And when we did that, that's when I joined Aspen. So I just wanted to make that point. But I think Nazee did a really good job of explaining the autonomy that we have. I cannot overemphasize that. You don't get that with every DSO.
Talking a little bit more about autonomy, Doc, and Dr. Chisholm or Dr. Whiting, whoever wants to kind of speak on this, but when it comes to procedures, this is the next question that came in. What types of procedures are you doing? And are you treating many patients with anesthesia without prior consultation? And if so, do you feel it is in any way a compromise to their safety?
I'll take it first because I know all the guys will have something to say about this. So Big Mouth will go first. So here's the deal with practice. I practice on what I want to practice on. I take care of the kind of patients that I feel best, and those that I don't feel comfortable with, we will refer out to more office-based local oral surgeons. So there is no dictating to you of how to practice. You do what you feel most comfortable with. And yes, I do anesthesia on most, if not all of my patients. And I do same day workups. However, I have reviewed most of those patients' medical histories before I meet them in person. I have two levels that it actually goes through. I have someone who I have trained to look through the medical histories and pick up on key disease processes or medications or what have you. And then I review them as well. And so for those patients who have medical histories that are compromised, then we send them out for consultation. Or if I don't feel comfortable doing it in an office-based itinerant setting, then I will refer them out to more of an office-based situation. In the 6 years that I have been doing this, and knock on wood someplace, I have not had any incidents at all. And I'm sure Nazee and Justin are the same way. You just have to be very fastidious about who you take care of, being very fastidious about reviewing your medical histories and medications so that there are no surprises when you show up at the office and take care of the patients. And so with good cooperation between your staff, the general dentist, and I've trained the general dentist on the things they should look out for, the cautions, the red flags, and all that kind of stuff. Between that partnership, as Nazee described it, as a family, we are able to take care of these patients more in a group setting versus me having to worry about every single little thing. I have a lot of eyes looking at that patient.
Dr. Whiting, anything else you would like to add there?
Yeah, I try to have good communication with the general dentist. I mean, they can know a little bit what I'm looking for as far as, health wise, and if I want a medical consult. They all have my cell phone. They always call or text me being like, hey, can you look over this medical history? Do you feel comfortable with this? Do you want us to send it out? Like, send things out to oral surgeons in the area all the time that I feel may need more follow-up or, closer eye. So yeah, good communication with the general dentist, and that really helps, avoid those.
I also want to add something that Aspen Dental right now is all digital. So you have access as a specialist or anybody else, any clinician, you have access to the complete list of patients, their charts, their even x-rays. So yes, you are not in that office until maybe tomorrow or the day after, but you have access. So you can, even if you want to check the patient, the medical history, the treatment plan, the x-rays, before you get to the office, you have this capability of doing it. So this makes it much also easier too.
That's a great point, Dr. Nazee. We're trying to make this easier for you guys. We recognize that you're traveling in this model, which is different than in private practice where you would just drive to an office and everything is set up for you. So that's the reason why we provide the access to all of our clinical records to our specialists. Dr. Whiting, this question is specifically for you. It says, I believe Dr. Whiting mentioned he still takes call, I assume trauma call. If so, how do you incorporate call at your local hospital with your Aspen schedule?
Yeah, these guys have been really nice to me. They let me just do weekend call because I told them, with my schedule, sometimes it's 2.5 hours away, and they understood that, and they were, very nice and letting me just take weekend call. but that still helps them out too. So it's mutually beneficial.
This next question, are the oral surgeons do they have any of their own practices?
No, nope.
That is correct. Only GPs own the practices, and then the specialists come in and travel and support their offices. So, question here about equipment. What equipment does Aspen provide for you, and do you get to choose your equipment and supplies?
Aspen does provide all of your equipment, and they also, well, again, earlier I talked to you guys about economy of scale and the fact that Aspen is contracted with certain suppliers that allows us to get our equipment and supplies a lot less expensively than a lot of private practices situations can. And so within that umbrella, Aspen is very flexible with allowing you to pick and choose what type of instruments that you want. And so when I first, for example, when I first started, I requested a Stryker handpiece and I was provided that. But unfortunately, with time, Stryker stopped their oral surgery support and we had to move on to a different handpiece situation. And so while I was doing that, Aspen kind of brought the samples in and I tried what they had available. And these days, those type of things are pretty ubiquitous and most handpieces are very similar. But anyway, bottom line is they're very flexible in allowing you to do that. The only area that, some people start to specify what type of handpieces and that kind of thing that they like. And there may be some difficulty there with trying to provide some of the more esoteric companies that are out there because we're trying to all stay under the same supply umbrella for repair purposes. And if something goes down, they can send you a loaner very easily. I've been very, very pleased with that because that's one of the biggest pain in the butts in private practice is dealing with that kind of situation and the expense of it. So Aspen's been really good and about allowing you the autonomy to choose that type of thing.
Yeah, I mean, I have a B&R. B&R is top of the line handpiece, and I had one, I had two, and I got another one, and so I have two B&Rs, and if it's not something that they have a contract with Aspen, you can tell them where to get it, and they'll still get it for you. You'll get whatever you want, so you can have as fancy of a material as you want, pretty much.
So this next, Dr. Nazeem, were you going to say something?
I mean, as long as it's related to dental-alveolar and our work, so kind of like anything related to dental-alveolar, implantology, even pathology, intraoral, will be provided and available will be provided. And as everybody mentioned, if our vendors or suppliers they don't have, or if you want anything specific, you can request it, and most of the times will not be a problem. I mean, some people I remember requested, arthroscopy, equipment. I mean, this is not going to be, we don't do TMJ surgery or arthroscopy in our dental offices. So those equipment or those orders will be, questions and, kind of like maybe not even provided. I know somebody wanted to do liposuction. This is not going to happen in our dental, offices, but anything related to dental alveolar, implantology, pathology is available and will be provided.
Great, because the next question that just came in had to do with what procedures are you doing, which you just mentioned, Dr. Nazeem, your dental alveolar. You're not doing any facial trauma cases or anything like that. You're focused on the bread and butter of oral surgery, essentially. We have time for a few more questions, and the next one that just came in. So I'll give it an opportunity to everyone to answer. This just came in. You guys have been very informative. Just out of curiosity, you all seem very successful and at different lengths of time with the company. What tips can you offer to last 2, 6, or 15 years to be successful as you all are? So we'll start with Dr. Whiting, who's been with us for 2 years, Dr. Chisholm, and then Dr. Nazeem.
So the question is how tips to be successful, and I mean, I guess just work hard, enjoy what you're doing, and the success will come. Um, there's not. I think there's a lot of successful oral surgeons, but you also have to be good with all the general dentists and the staff and everything. That's really crucial to get along with everyone, because you do have to deal with a lot of different personalities in every office. So you got to be more flexible and be a good team player for sure.
I find that success with Aspen is very similar in a lot of ways to success in private practice. If you treat your referring doctor at the end of the day, for all you new oral surgeons out there, and I think the other guys will agree with this, you come out of residency and you're at the top of the heap. You've done the best oral surgery, the most fancy residency that dentistry offers. But in private practice and in real life, oral surgeons exist off the benevolence of our general dentistry brothers. You are living a total referral lifestyle. So if you get out and you're personable and you treat people like you want to be treated, then, and make this team concept true, you will do well. People will refer to you, feel good about it, and help you grow your practice. It's the same way in private practice. The guys who get out and are arrogant or think more highly of themselves than they probably should, they don't do as well. The same thing can be true in Aspen. You're not going to have a successful career if you're not a team player. So for me, it was about coming in and understanding my role in the team in Aspen, ingratiating myself with not only the general dentistry, but the office managers, the regional managers, the directors, even those folks like Veronica, who were in charge of specialty support. I think it's a good thing and very important to have a good working relationship and respect their job as much as they are respecting yours. And if you do that, you'll do fine with Aspen.
So, I think everybody mentioned everything that needs to be mentioned. So I can summarize it. If you want to succeed as an oral surgeon at Aspen, which is very similar maybe to private practice, you need to have two things. Number two is, as Dr. Chisholm mentioned, and Justin too, is be a team player. This is a team model. It's everybody together. If you play as a team, you will win. Individual doesn't work. Number one is relies on you. You have to be a good oral surgeon. If you don't know things, you have to read about it. You have to learn about it. You have to be a skillful oral, compassionate oral surgeon. So it's not a matter, get me 20 IVs quickly and send home, and then having patients screaming, about everything. So if you do your job very well, I'm talking about the oral surgery aspect, the knowledge, the skills, and then be a teamwork player, you will succeed at Aspen and, in my opinion, in a private practice.
I'm going to say one more thing about what Nazee said, Veronica. I'm sorry.
No worries, Doc. Go ahead.
What Nazee said about being a skillful clinician is imperative. Because you work in different offices every day, it is important that you treat these patients to the best of your ability and doing what you know that you do well, so that you don't have a ton of complications that ends up at another office when you're at another office and your general dentistry friends are calling you and saying, what do I do with this? This patient's having pain, these tissues torn up, or this implant's failing. Do your job well, and you will do well. It's very important, and I completely agree with Ms. T on that.
And our last question, and if whoever wants to take it can take it, but the last question has to do with COVID-19, which we're all still kind of living. What has Aspen done to help you and your patients feel safe in the offices?
Go ahead, Nazir.
All right, so I'm, you know, my answer to this, comparing myself to a lot of my friends, oral surgeons who own private practices and general dentists too. I mean, Aspen has done an amazing job providing us all the PPEs that we needed, whether we needed to protect ourselves or to fulfill the state requirement. Every state has its own requirement and is mandatory to follow those regulations. So Aspen, since the pandemic, you know, started, we had at that time sometimes bi-weekly meeting and then changed to a weekly meeting, updates about all, you know, the regulation, the guidelines, the updates about the virus and the equipment. And they made, you know, our lives, whether it's as specialists or general dentists or hygienists, much easier, and you know, also protected to us. So they not only provided us with the equipment that a lot of my friends in private practice did not get, okay, but also they protected, you know, they did their job from protecting us and the patient from installing a lot of requirements in the office to protect everybody. So they did an excellent job, in my opinion.
I'll piggyback on that. Here's where, again, the economy of scale works so greatly in Aspen's benefit. Back when this pandemic first really got going in March and April, and there was a run on PPE, a lot of my friends in private practice could not get N95 masks. They were having a difficult time getting gowns and other protective equipment. But because of Aspen's stature in the supply chain, they were able to get priority for all of this PPE, which they made sure. I have gotten at my personal home several times a box of N95 masks that specialty support sent to make sure that I was covered. You know, that means a lot to me. And it's not, if you were in private practice, these N95 masks now are around $3 to $5 a piece. That all cuts into your bottom line. But with Aspen, not only, you know, did they make sure we had access to it, they provided it for us. So that's just a small example of, you know, of how they make sure that we're practicing safely. And they also have a list of rules that as practitioners, we kind of all came up with that is enforced at every Aspen location, so that not only the staff's safe, the doctors are safe, but the patients are treated safely as well.
We are unfortunately at the end of our time, but before we end, I want to say thank you to all of our panelists, Dr. Nazir, Dr. Chisholm, Dr. Whiting, for taking this time to share with all of our participants. Thank you to the participants for all your great questions. And we look forward to meeting you during our one-on-one career guidance and interviews this afternoon. So please enjoy the rest of our VIBE event and have a great weekend.
Thank you.
Thank you.
Take care.
Thank you.